I think there was a confusion, I think even within the media, of professional misconducts with human rights abuse, and they were conflated. And I've tried to separate this because they are distinct and they require different pathways to be dealt with within the health profession. I think the second feature of this complaint was that every witness blamed the Eastern Cape Health Department of Health. Every. I interviewed 34 of them within 36 with 36 interviews, and I did not find people who did not actually say something that was wrong within the department. And then I think there was another chorus that said that the management, I suppose, at the hospital was in disarray and obviously engaged in a crusade or a power struggle for change. That is what was occupying them all the time, and that's what irritated and frustrated Dr. Sukeri, and that's what allowed him to go to the media and do what he does. But I'll spell that out. Then there was the complaining Dr. Sukeri, which was the fourth issue. Dr. Sukeri holds a degree, MBCHBA, like all of us who are medical doctors. He's a fellow of the College of Psychiatry of South Africa, like most of you who are psychiatrists. He holds a PhD from Walter Sisulu. I went into his research gate, which is a metrics analysis to see how doctors perform by their peers. His articles, I think there are, the recent one, there are 18 citations. I went into his age index. I think for those of you who want to know, the age index measures the productivity and the citation index of a scientist. If you want to claim that you are a scientist, that's what other scientists will measure without you, because it's all on the internet. There was no recording for Dr. Sukeri on this issue of the age index. However, Dr. Sukeri released unverified, false and exaggerated and damaging death statistics into the media, to the public. He violated his professional oath and his employer's confidentiality contractual clauses. And every witness said no amount of anger or frustration could be an excuse for a senior professional to behave this way and violate his professional and contractual oath, ethics and codes of practice. Everybody disagreed totally with the manner and ways in which Dr. Sukeri raised his complaint and went about it. In the process, he irretrievably broke all trust and confidence with his colleagues, both at Tower Hospital. In the Eastern Cape province, nobody wants to work with him anymore because they don't trust him. Now, let me come to my major findings. I can see that most of you are sleeping or getting depressed. You're going to wake up. Now, let me come to the major findings. First of all, the first major finding is that I could find no prima facie evidence of institutionalized, systemic, or deliberate violations of human rights by staff at Tower Psychiatric Hospital and Psychosocial Rehabilitation Center. I could find none of this. The institutionalized, systemic, deliberate violation of human rights, I could not find that. And I want that to be remembered. There were none. There was one that everybody agreed upon, everybody, including Checkpoint. They showed this so-called the seclusion room, which I think is a relic that came with the building of the hospital in 1894 and continued to be the practice there, but it's only practiced by a few. So save for that, I identified a number of, as I say, professional misconducts that I list in the report rather than abuse of human rights. Again, there were no other degrading and inhuman treatments observed or found as alleged by Dr. Sukeri. This finding was corroborated by evidence from the Office of Health Standards Compliance Investigators, the Mental Health Review Board of the Eastern Cape Central Region, the Eastern Cape Technical Task Team, and evidence from the research that I had done and all the 34 witnesses that I interviewed. So Dr. Sukeri's COI complaint was primarily about chronic systemic failures and neglect of the Eastern Cape on mental health care services, with pernicious systemic effects and power struggles for change, what I call a crusade for change. It was not about human rights violations because primarily, as initially alleged and peddled in the media. I want to emphasize that. The primary complaint was coy, deceptive, and it was not about human rights. It was about systemic failures of health services to mental health people in the Eastern Cape. However, Dr. Sukeri, like a highly trusted scientist, failed to conduct basic things, to conduct credible studies, research, or audits with rigorous verifications as the basic requirements of any scientist, data or figures available before making these false and damaging pronouncements to the public through the media. This was a grave error on his part. Here is the first finding that around which everything revolves, and again, I want you to remember it. Over an 8-year period, 68 mental health patients died at the hospital. 8-year period, 68. I don't know how many of you have ever visited a hospital and you ask yourself, over an 8-year period, if you have 68 deaths, what would you say about them? This is a 400-bedded hospital that has 68 patients die over an 8-year period. That translates to about 8.5 patients a year in a 400-bedded hospital. However, I think the media did not actually capture this period of death. So what did they say? They said 90 patients had died. Now you remember when I released my report on the 1st of February on life as a demeni, it was 94. So what got etched into the public's mind was that, oh, here is another life as a demeni. And this is where the noise that I was talking about of the orchestra started. That because of the closeness of the figure, because of the failure to actually articulate this in terms of a period, something so simple, basic, get translated into a major issue that became a national issue for the wrong basic fact. Now, let me put it into perspective. At Life as a Demeni, at the end of my investigations, 144 patients had died, which means 12 patients were dying per month. At Tower Hospital, I've just told you about 8.5 patients were dying per year. If you divide that by 12, it translates to 0.71. So there were 0.71 patients dying per month at Tower Hospital compared to 12. If you were to divide 12 by 0.71, it gives you a figure of 17. So the death, the greatness of death at Life as a Demeni was 17-fold compared to what was happening at Tower Hospital. Neither could you say 8.5 patients who die in a year in a 400-bedded hospital. It's something really that is totally so abnormal that you could make an issue out of it. I think that point must be clarified. However, by not verifying and by not doing very simple studies, what happened, Dr. Sukeri did, was to provide and release shoddy, poorly researched, falsified and exaggerated patients' vital information into the public via the media And this amounts to scientific fraud or scientific misconduct. And I'll read the paragraphs of the fraud that it means here. He violated the general accepted research practice, and this means improper reporting of results to present a misleading outcome. That's what happened here. The outcome was misleading. The second problem, he falsified the data. Rather than manipulate the experiments or data to generate preferred results, this transgression simply fabricates the data entirely. That's what happened here. I have cited the reference for this, and I hope that you can be given this document so that you can begin to see it. Now let's remember that the hospital had just undergone a national core assessment, standard assessment. They had scored 89% in 2017. So you are dealing here with a functional hospital. There are not many hospitals, I think, in that assessment that scored at that level. There must have been about 5, if I remember well, but that can be corrected. So you are dealing with a functional hospital that is performing very well, despite all the challenges that it, and then you go and come up with this kind of information. So I want to put it to the audience and the media today. There was this false life esidimeni copycat phenomenon that I think we should disabuse ourselves as a country. And this copycat phenomenon had arisen because the media had gone on to a saga following, I think, Ms. Fenter's report and city, and then the ENCA checkpoint report. Again, I want to repeat, the reported death of 90 became etched in the public's mind, reinforced by a reported statement by Dr. Sukeri himself, saying the government did not seem to have learned any lessons from life esidimeni, close quotation. And another documentary flighted as the next life esidimeni to air on ENCA by Health E-News and something called the Grokits Mail on the 11th of June. All taken together, this media frenzy created this copycat phenomenon comparison. At the time when these things were going on, Dr. Sukeri would have been fully aware that the final death total for life esidimeni was 144. So what did this frenzy create? It created basically a national mass hysteria, a shame, particularly soon after the life esidimeni tragedy. This bandwagon comparison blew a very simple complaint into a national issue that it should not have been. But here is another funny part of this story. Because in the life esidimeni, there had been constitutional damages. Some people started to go around opening bank accounts and say, we are waiting for our own life esidimeni in the Eastern Cape, because this is what we are going to get. So people started to call their problem in the Eastern Cape the life esidimeni 1.2 million. That is what it got called. And this was evidence presented by one of the advocates. However, I again want to emphasize, it was established and confirmed by all concerned, Dr. Sukeri included, the OHSC investigators, Ms. Petwane and Munyela, Ms. Ngume, the CEO of the hospital and the chief executive, the chair of the Eastern Cape technical task team, myself, that a total of 68 and not 90 patients had died. So if you subtract 68 from 90, it's 22 patients that was misplaced, that were inflated, that was wrong. Now, I want to defend the newspaper. when the newspaper wrote the first article, they gave it to Dr. Sukeri to check. He checked the article and approved it. So whatever came out of the newspaper, it had his approval. So he takes the consequences of what happened here. So again, I get back to my point, that there was a 17-fold increase in death at Life Esidimeni compared to the Tower Hospital. More importantly, you would remember that at Life Esidimeni, people complained, how can you say that the people died as a result of what happened in Life Esidimeni? We went around and did postmortems. And the postmortems were able to link the death with what happened in the NGOs or some of the NGOs at Life Esidimeni. There was no such a link between the 68 deaths and what had happened at Tower Hospital over the 8 years. So I think that's a very important, scientific fact that should have guided whoever was going to bring the complaint. There was absolutely no link of the death with what had happened there. More importantly, there was no link between those deaths and the so-called alleged human rights violations, because they were actually not there. Again, I quote Justice Museneke's reference about the human rights violations that were a primary driver of what had happened with the Life Esidimeni matter. Therefore, in my view, and based on the evidence I've given you, to compare and label Sukeri's complaint as another Life Esidimeni in scale or magnitude or any other dimension was both and is both misleading and false. However, here comes the story. Dr. Sukeri, under oath, admitted that he was wrong in this comparison. Having made he then went to make the corrections and admissions that he made statistical miscalculation under oath. So he was wrong. He then wrote a written apology to the National Minister of Health that he had made this mistake. He had written to me too that he had made this mistake and he's apologetic. Now, this is the mistake that, because we are internet connected, has gone throughout the world, has damaged our reputation as a nation, as I say, just after Life Esidimeni, has created the reputation of many innocent people in the Eastern Cape to feel ashamed of themselves because they believe that they have actually caused the death of many people that they did not actually cause, and for which it was a basic error of statistic by a medical scientist who was the head of psychiatry at Tower Hospital. So there has been an apology. So again, I want to make it clear. The Life Esidimeni comparison was not only factually inaccurate and far from the truth, but was also ill-informed, poorly researched, unscientific, false, exaggerated, and based on inaccurate statistics. The incidence at Tower Hospital is no Life Esidimeni. I want to list the concessions of Dr. Sukeri. He conceded to miscalculating his death statistics. In his own words during the interview, he called this a serious mistake on record. His death statistics were wrong. To this end, he has apologized in writing to the National Health Minister and the Health Ombud. Dr. Sukeri himself acknowledged during interview he should not have gone to the press. But we know that actually the press didn't go to him, he went to them. Some of his statements in his letter of complaints were based on opinions, with no substantiation, with no credible research, with no proper scientific basis. Let me give you a simple example. Dr. Sukeri made a complaint that patients were the quality of food was poor, and therefore the dignity of the patients suffered. When I interviewed him, I asked him, as a medical doctor, what is the evidence that the quality of the food is poor? Are these people malnourished? Have they lost weight? Has he seen anything medically that could tell him that as a result of eating this food, they were suffering? Were there any complaints from the patients? There were no complaints from the patients. So where did he get this complaint and then link it to the dignity of the patients? The patients, of course, ate ngushu, which is what they eat in the Eastern Cape. Now, he cited that they were not complying with guidelines. Now, in the guidelines that are written by Western doctors, there is no guideline for ngushu. But you then go and use that. And every patient in that hospital looks healthy and strong. You don't see anybody who's suffering from pellagra, malnutrition, or increased illnesses. But you then go and make a complaint that, okay, because they eat ngushu and there are no guidelines for ngushu in their books, therefore their dignity is suffering and the quality of the food, it's wrong. Now, I pointed to him during the interview that as a medical doctor, if I say you suffer from iron deficiency anemia, which is a condition I know a little bit about, the only thing that will cure you is iron. If you go and take vitamin B12, you won't cure iron deficiency anemia. That's how specific biology is. Now, if a patient is eating poor quality of food, as an ordinary doctor, you should be able to recognize something in this patient that makes them suffer, to say for you that there is something here that is wrong. There was nothing like that. He admitted to that. So why did he come to that? I don't know. He complained about patients' clothes that took their dignity. When I asked him, did he see anything? He only saw one patient who was wearing clothes that were banned with cigarette stubs. Now, that is not torn, it's banned by cigarette stubs. And of course, he had seen a notice in the board that patients were wearing torn clothes. Again, he didn't go and verify with the person who released the notice as to what was the cause of how that notice came about. So I'm giving these two examples to show you how coy and deceptive the complaint was. And again, I recognize that this complaint was important. Now, I'm going to appeal and make this appeal to the media. And I'm only making it as an appeal. It cannot be a recommendation because I was not investigating the media. And I've taken the trouble to write it so that I can read it to the media today. I'm appealing that the media that participated in peddling these falsities, the Rapport, City Press, the Daily Dispatch, Graucourt's Mail, the ENC and Checkpoint, and others, should consider withdrawing these articles and documentary and joining Dr. Sukeri in tendering a public apology. It cannot be acceptable and be ethical in a constitutional democracy and a knowledge society that the public continues to be informed and educated on proven and acknowledged wrong scientific facts. We cannot create a successful, non-racial, non-sexist, and equitable society on the basis of lies and untruth. I think we've got to accept that, and I'm humbly asking the media to go and look at themselves. To go and release vital statistics, you need to consult with people who deal with vital statistics. It's the statistician general. There are many other epidemiologists who understand this. You don't just jump off. I do that all the time, and I do have a little knowledge of medical vital statistics, but I still have to consult the gurus in the field rather than bring the sensation that comes, I think, with reporting. That's that point. I'm going to make maybe a few others before I release everybody. Patients' confidentiality and dignity. He made another allegation. This, in medicine, it's a violation of a cardinal rule of medical practice. You don't violate people's confidentiality. Any third-year student knows that, because when you arrive in second year, you sign a document that goes to at the time it went to the Medical and Dental Council, now it goes to the Health Professional Council, that you are going to keep confidentiality. I just want to quote from the General Medical Council in Britain. It says, "Trust is an essential part of doctor-patient relationship, and confidentiality is central to this. Patients may avoid seeking medical help or may underreport symptoms if they think that their personal information will be disclosed by doctors without consent." Close quotation. Thirdly, doctors are under both ethical and legal duties to protect patients' personal information for improper disclosure. This is precisely what Dr. Sukeri did by sharing personal information of patients with the journalists of the report, by showing them the old death registers which contain those information that are about the names of the patient, the diagnosis, what they died of. That's a no in medical practice. He did the same thing on television. Some of you, if you still have recorded that, you can go and see that he showed patient's name, diagnosis, their ages, and so forth. That is a no. You don't do that, even if you are angry against anybody. So by violating the confidentiality of the patient, he violated their dignity, which he is complaining about from other people. He acted in the most unprofessional way for a senior health professional in a profession that I regard as noble, a profession that is steeped in centuries of values and tradition, a profession that is steeped and directs ethics and codes of conduct to advance and improve human life and to harm no humankind. Here comes another one of these matters that I have to report to you. Dr. Sukeri then discharged patients from Tower Hospital without authorization and following the legal processes. Dr. Mbengashe, who is here, maybe can take questions on this matter. Because every day this has been a moving train. During the investigation, the investigating officers from the health compliance and also the Eastern Cape task team discovered that 142 patients had been discharged without legal documents. 51 of those were discharged by Dr. Sukeri, the most senior psychiatrist at that hospital. All of them, fortunately, have been found. I can say that to you. So it's not like life is diminishing again, where there are still some patients that they are still roaming around the streets and have not been found. So patients were discharged illegally and without authorization, and this was part of the power struggle between Sukeri and the CEO, that you cannot discharge patients out of this hospital without my authorization, but more importantly, without establishing where the patients are going to be going, whether there is a social structure to support them out there when they leave the hospital. Now, 51 were discharged by him. I then requested Dr. Tobile and his team to go and look and find out what has happened to these 51 patients. 11 of these 51 patients are not coping well in the community. Some have relapsed, they are back in the hospital. They have been readmitted. One user has been reported missing. 2 users have passed away. 1 user has committed suicide. Another user has committed crime and is imprisoned. So, what do you say about that for a senior consultant in one of your hospitals? To have him discharge patients illegally and they relapse, they get readmitted. Obviously, and I want to make this point again, that some mental health care users have been readmitted one committed suicide, one committed murder, and others are not coping well in the community. As far as we can tell, it questioned the quality of assessment that were being undertaken by Dr. Sukeri and with which team. It questioned his clinical judgments and decision, and clearly questions his competence as a doctor. And those are not things that I can do, but that's what, if I was his supervisor, I would question his ability as a doctor. Clearly, as I've already mentioned, out of going to the media, he created an irretrievable breakdown and loss of trust and confidence with his immediate colleagues in the hospital, with people in the Eastern Cape. So I do believe that Dr. Sukeri is guilty of this. He brought our profession into disrepute. He brought the nation of South Africa into disrepute. Obviously, there are economic consequences that are as a result of this, because we are now seen as this country that always violates human rights, despite the fact that we are sensitive to this. So that's about Dr. Sukeri. Now let me come to the Eastern Cape, because this is where Dr. Mbangashe and his team. As I said initially, everybody said the department was the problem. And I just want to list some of the things that they have a problem with. They failed, I think, to provide or to prioritize mental health services over a long time in the province. And this has a long history from the time when the TAC and Section 27 did an investigation in 2013, from the time when I think even Dr. Sukeri wrote 3 articles about it, and there was a ministerial task team report that visited the 9 provinces that made some comments on the province. We do recognize that this is a rural province where they've got difficulty in attracting staff. And also, I think what Dr. Mo Nagdi said, I think in his email that is part of your document. I think all the complaints taken together demonstrated that, the department has a problem of actually organizing and delivering proper mental health care services to provide the leadership and governance of mental health. And of course, to fail, I think, to treat specialists and staff apparently with respect, as I think is seen by many of the specialists, and to get them together, to work together in the best interest of, I think, of the patient. Let's remember that one of the things about deinstitutionalization that people talk about is the failure to develop community-based mental health. This is still something we're struggling about. And there is very little of that in the Eastern Cape. So they failed, I think, to guide and provide support to Tower Hospital. And they failed, I think, to provide to instill the disciplinary measures that were necessary. Here is something that has always made me laugh and my staff laugh. When I was interviewing one of the senior staff in that department, he said to me, he comes from the military, and in the military, we scop or skid and donor. So he is such a disciplined, that's what he does. And I asked him, sir, give me one example of where you have scopped and donored anybody. He said to me, I can't find any. So I said, so what are you prescribing this for? He says, no, the environment in the department is not yet ready or due for this kind of treatment. So I said to him, you don't look like a young person. How long are you going to wait for this? He says, I'm retiring in 6 months. So here you are. You have people that makes all these pious and glorious statements about what service they can deliver. And when you get to the bottom of it, there's no service delivery that is being given, except that they make all the statements. And this was really the problem that was being articulated by most of the people. I now make a few recommendations and I shall shut up. Again, I go back to the national minister. The national health minister must evoke the appropriate and relevant section of the Constitution to appoint an administrator with respect to mental health care services only with respect to mental health care services. I'm not saying that the department of Dr. Mbengashe must be taken over by administrative. I'm saying that section that has suffered with this complaint must be addressed. Again, I want to emphasize what I said in my Life SED main recommendation, that the complaint of Dr. Sukeri has re-emphasized the urgent need to review the National Health Act, the Mental Health Act of 2000, that took away the powers of the President of the country, the National Minister of Health, the magistrate in addressing issues of mental health services nationally. I believe that locating mental health service at the provincial sphere of government in the so-called concurrent competencies has created difficulties rather than solutions to mental health services. I think this should be addressed as an urgent matter, that we, if ever there is an epidemic that is emerging, we all talk about obesity, diabetes, and all kinds of mental health. It's a bomb everywhere in the world. You think about the UK, you think about Europe, the scourge and the tide of mental health. Because all of us are carrying a mind. There's no human being without a mental health. Sometimes that status of health makes us creative. Sometimes it makes us geniuses, but also sometimes it makes us the Hitlers of the world. It's all part of the mind, how we exercise it, in what context we do. So I'm asking that the National Minister of Health really re-looks into taking back the powers that are important in this emerging epidemic throughout the world, that maybe he leads that kind of process. As for Dr. Sukeri, I have asked that he gets reported to the Health Professional Council because I don't have disciplinary powers. And this must be done urgently, and I will forward my report to them, because there are serious professional misconduct and violations of codes. And I've listed the rationale of why. Somebody is obviously looking at the stock exchange as we're talking. And I just want to list them. Dr. Sukeri, again, released unverified, false, and damaging death statistical information to the public, and in so doing committed scientific fraud. Dr. Sukeri violated the confidentiality of patients, and by so doing took their dignity away. He violated his confidentiality clause that he signed with the employers at the Eastern Cape. He failed in his duty of care as a professional. He violated the Mental Health Care Act. He discharged patients without proper authorization and without following the Mental Health Act. By so doing, Dr. Sukeri denied Ms. Ngume, who is here, the CEO, the right to exercise her duty fully by discharging patients without her knowledge, which he actually said. Dr. Sukeri was found, he was untruthful, he was evasive, and he was duplicitous. That means he was two-faced. He said one thing to me, he would say something else to another person, and he would say another thing. Now, you couldn't have a witness like that. As I said, for those of you who I grew up watching the Carry On films, and there is the Kaiba of, there is somebody called Sir Ralph Diamond, who is the governor, and there is another person who is in charge of one of the governors in India, and they are playing golf, and the other one says, you must watch this guy because he is two-faced. And he says, I'm going to be better two-faced than him. and this is during a polo match, but it's called Sydney Rider, Ralph Diamond, in the so-called carry-ons. For those that want to laugh, you can always go onto that movie. It's on YouTube. It's actually interesting to watch with your children. So I've listed all the things that Dr. Sukeri have done, and I've also said that the Health Professional Council should consider the immediate suspension of Dr. Sukeri from any practice, pending a process to assess his fitness for office. as I've proposed and I've said in this report. Disciplinary proceeding must be initiated against Dr. Sukeri in compliance with the codes that he befits, and this should follow a fair and a transparent and a due process. He must be charged with gross misconduct and incompetence based on the findings that I've already listed. Consideration, of course, must be given that he may need psychological assistance and counseling himself. Currently, I think from all the evidence I've gathered, he is like a round peg in a square hole within the Eastern Cape. He has lost all manner of trust and confidence, and something has to be done because he's obviously a highly qualified psychiatrist. He has irretrievably broken trust within the province. I believe that there are details of what I've spelled here. However, again, I want to ask the media and Dr. Sukeri that they should sit together with all that he has admitted, make a public apology to the nation because they have caused gross damage to our country. They must do that together. I know, as I say, this is not a recommendation. For Dr. Sukeri, it's a recommendation. For the media, it's an appeal. Because, as I say, the media, as the fourth estate, is important for the vibrancy and the development of our democracy. We can't do that with a media that peddles lies. It doesn't work. No country will survive that. Again, I want to emphasize many people's reputations have been damaged through this process, this noise that I've spoken about. There are other recommendations that I've made that are detailed in my report. And I want to conclude as follows. I think in one of his progress report forwarded to me, even as early as this morning by his team, Dr. Mbengashe highlighted a number of activities that are already taking place in the Eastern Cape to address some of the issues that I've raised here. So I think there is an admission and an understanding within the province that some issues needs to be addressed, and a process has already taken place. The so-called the rooms, the seclusion rooms, have already been replaced. And I think for the journalists, they must go there and take pictures and show them to us what the new rooms are like, because they showed us the old rooms. So, and funny enough, in his response to me, Dr. Sukeri says he welcomed the recommendations that I made because he has already seen that progress is being made in the Eastern Cape in relation to my recommendation. I recognize that advocacy for patients is a well-recognized phenomenon within the health system, and I support that fully, that all of us have to advocate for patients. Otherwise, we wouldn't be where we are. I remember during our days at Allen Taylor, residents as students and so forth. However, I want to make the following point. However, health professionals must observe and practice the highest ethical standards, must respect the truth, and must be truthful at all times as advocacy, and they must advocate with integrity. There is no place for advocacy through unethical conduct, or through lying or peddling untruth, or through the disrespect for tried and tested professional complaints processes. There is equally no advocacy in my mind through bringing disrepute to a profession, to a health system, to a nation, and to fellow professionals, and to fellow other innocent human beings in the country. I do hope that through these findings and the recommendations in my report, the Eastern Cape Department of Health, the mental health professionals in the Eastern Cape can work together to create an attractive working environment and service which are in the best interests of the patients in the Eastern Cape in relation to mental health. I will stop here, and later on I'll obviously have to answer a lot of questions from the media again. But I hope that we're able to be friends when we live here. Thank you.
Thank you. Thank you very much, Prof. We'll now hand over to the Minister to give remarks related to what the Prof has said about the report.
You see, the Minister knows about television, so that's why he's getting all the...
Yes. As you know, Prof, I've been here before under circumstances that are not always friendly, so I do know. But thank you very much. Let me acknowledge my colleague, the Deputy Minister of Health, Dr. Phaahla, and also the Office of Health Standard Compliance and the Ombud Person's Office, and all the other heads of institutions here today, including the chairperson of Portfolio Committee on Health, Dunjo. Thank you very much. I think Professor Makgoba has said a lot. Those who attended the Life is Demanding report will remember what I said then when the report was released, that I'm not in no position to talk a lot, because in terms of Section 80 of the Act that established the Ombud Person's Office, any accused person within a period of 30 days can appeal to me if they do not believe the Ombud person's findings are correct. The law provides for that. And in appealing to me, I must consider the appeal and set up a tribunal, which must be chaired by a retired judge or magistrate, who must be helped by 2 senior psychiatrists. If you may remember, it actually happened like that in the Life is Demanding saga. There were appeals by the then head of health in Gauteng, Dr. Selebano, and the director of mental health, Dr. Manamela. They both appealed, and I set up a tribunal which was chaired by the retired judge president of Gauteng, Gauteng North, Justice Mwebe, who was helped by 2 retired professors. One, a professor of psychiatry at the University of Cape Town, Professor Robertson, and the other, a professor of pediatrics, retired professor of pediatrics at University of KwaZulu-Natal, Professor Hussein Kovadia. They had the appeals and they dismissed them. And after dismissing them, it gave space to the Judge Moseneke process, which we have all witnessed, because those appeals were dismissed. Now, that process has to be respected. And for that reason, I cannot sit here and make a lot of judgments, because I'm going to be receiving appeals, if there are any. But I want to confirm that, yes, Dr. Sukeri did send me an email to apologize for what he has done. I did not respond to him, not to him or to anybody, because I think the issue goes beyond me. As Professor Makgoba has said, it's a very serious matter for the reputation of the country, and reputations have been damaged beyond the reputation of the healthcare system, of course, which you are seeking to damage anyway. But to further state that, as Professor Makgoba has said, we are now internet connected. We are one world. Any information that we issue about ourselves, anything that we report about ourselves is heard beyond the borders of this country. I just want people to be aware of that. On Sunday, the Minister of Social Development, Mesusen Sabangu, is heading to Geneva to give a report to the United Nations, which is a report they require every year, about what the country is doing for people with disabilities, people living with disabilities. This year's report is rattled with Life is Demanding, that she needs to bring together a team that will report what have we done, how did we, resolve the issue, where are we, etc. That's what she'll be doing for most of next week, and she's departing on Sunday. Obviously, there are people already there who have picked up this saga of Dr. Sugeri, who believe now we are a country which doesn't care, obviously. I just want people to be aware of that. But also that the copycat phenomena, Life is the main copycat phenomena, which Professor Makgoba has described, is quite widespread in the country. Everybody who wants something from the Department of Health want to extortion by invoking the issue of life is demanding. Anything from a position to more money, to being employed, to getting employment in the areas they choose. If that can happen, they evoke the issue of life is demanding. There was even a group I just heard accidentally over the radio, who I later learned is an association which is not even being recognized, who were claiming that the Health Professions Council is overcharging them for affiliation. The affiliation fee is too much because most of their members are unemployed. And he evoked life is demanding. I just couldn't make the connection. He said, no, the minister must make the Health Professions Council not overcharge us, which of course I don't levy fees for professionals to Health Professions Council. The council does so because it's an independent body. But he threw it back at me and even pleaded poverty. And mind you, these are professionals, but that is the sign of our time about life is demanding. I hope maybe today, with the reports from the Ombuds, people will think twice before evoking the copycat phenomena of life is demanding. Lastly, it is true, and I want the country to be aware of it. There is a clear explosion of mental health globally and within our country. There's no question about it. You might be aware that the World Health Organization even called a summit in 2013 and drew the mental health plan 2013 to 2020 because they are worried by this phenomenon. We came and localized it here at home, and that's why it was so unfortunate that life is demanding happened, because everything that was a declaration from that summit in the life is demanding saga was not followed. People just breached as if we never, as a national department, as if we never set the rules. The report was there, it was clear on what should happen, but people went to do something else and put the country in that unprecedented crisis. But there is an explosion of mental health. Last month, when I was in Amsterdam for the International AIDS Society Conference, the Minister of Health in Canada asked for a bilateral with me. And I agreed, and she told me about this problem, that we have got to do something. There is an explosion of mental health, which is getting out of control. And she asked me if I could join a focus group that will pressurize the United Nations to prioritize mental health in the world. And she told me that the Minister of Health in the UK has already agreed to join. And of course, I said, there's no way I can refuse. I'm aware of the phenomena, so I'm in. And we wanted to coordinate and say, United Nations, please watch out. Back here at home, we are already aware of the crisis in many ways than one. For instance, the criminal justice system is also stuck because of this issue of mental health. There is a new phenomenon of lawyers who are defending criminal accused to refer them for mental observation. It's happening almost every day. It's becoming standard now. And the judges and magistrates, I'm not judging them. They just issue it. And what are the results? As I'm sitting here in front of you, there are 1,400 criminal accused who are languishing in our mental health institution, waiting for mental health assessment. I'm quite sure that many of them are just criminals, that's all. But they've taken space for mentally ill patients who can no longer be admitted there. And we leave them in normal wards. We do have normal, if you understand what I mean by normal, ordinary wards in our hospitals, which are now housing mentally ill patients because there's no space for them in our mental health institutions like in Gauteng, in Sterkfontein, Wetskoppies, etc. Because there are people there who are waiting for assessment. Now the question will be, why are we not doing it very fast? Because in the public sector, we have got very, very few psychiatrists. Dr. Ratayamani, if you don't mind, you might remind me of the figures of how many psychiatrists are there in South Africa and how many are in the public sector and how many are in the private sector. I'm not sure whether you are ready with the figures. I know it's an ambush, but people might like to know.
So we have about 700 psychiatrists registered, and almost 5% of those are in the private sector. So we have only 25% there in the public service.
Yes, that's why we are unable. And maybe I'm not bringing anything by back door. That's one of the reasons why we have to change the healthcare system to NHI, so that we can have people, whether in public or private, making use of the health service of the country. So we are unable to clear that backlog. And so in the few months' time, we'll be issuing a contract under NHI, a project, because NHI is not yet a law, but it has got projects. We'll be issuing a contract to hire 51 psychiatrists in the private sector and 72 psychologists to go and clear this backlog so that our mental health institutions can go on admitting really mentally ill patients, not criminally accused, who it is believed might hide behind the issue of mental health, taking advantage of the explosion. That's one of the things that we are faced with. We are also looking into the possibility of expanding that every hospital now in the country must have a ward for mental health. So that it's not only mental health institutions that admit these patients. It's the explosion of the phenomena I'm talking about. It's not nice, it's quite scary. And we also hear that even among our students, the phenomena of depression is expanding ever and ever. I was phoned, at least after the funeral of Professor Mayosi, I was phoned by one student organization, which for now I'll not name, asking for an urgent meeting with me. They said, we've been in the closet for too long. We know many of our colleagues who suffer the problem of depression, but they've been in hiding. Now they want your help, and we cannot get help if we approach the things in the manner that we are doing. So lastly, why am I telling you this story? To defeat this phenomena, we should not make ourselves a laughing stock of the world in the way we did in Life is Demanding and in the way this tower case was handled. We need to stick together. We are faced here with an epidemic that can tear our country apart. It does not need people who, are hungry for glory. Because I've realized after Life is Demanding, there are lots of people who are hungry for glory, who are throwing at everything to be famous on the back of Life is Demanding, because some did attain fame during that period. So we don't need something like that. We need to sit together, the Psychiatric Association, the professors, mental health professionals, because there is a big problem in the country that needs to be solved. So I just want to thank the Office of Health Standard Compliance once more for this sterling job, and I wish to thank the Ombud for once more this very incisive investigation And just to remind people again, when we established the Office of Health Standard Compliance via the National Health Act 2003, I still remember how difficult it was when I made this proposal about the Office of the Health Ombud. People were confused. They said, but we have got councils, the Health Professions Council, the Nursing Council, the Pharmacy Council. What is the Office of the Ombud doing? And I tried my best to explain. And when I got it difficult, I just said, this office is the public protector of health. And I thought then people will understand, what do I mean by public protector of health? Because I realized within our healthcare system, something was missing to try and protect the health of the population. And I think in this second report of the Ombud, we could see that we've been missing that office for a long time. Thank you very much.
Thank you, Honorable Minister. I will now, without wasting any time, hand over to the Ombud to hand over the report to the Minister and also to the acting chairperson of the OHSC board.
But I've got only one report. I don't understand. But also, I notice here, the handing over is a long process. I'm just going to hand over. There's nothing I'm going to do. Yeah, they say how, I mean, it's a
20 minutes hand over.
Can I have the, can I have that to the minister?
Well, maybe they thought you'll make another speech
No,
when you
no.
hand over.
No, here is Mugashikone. Let me get the other copy, or the other copy. Thank you. This is just, that's what it's supposed to be. Nothing more than that. Okay, thank you.
Thank you very much, Prof, for handing over the report. I'll now open the floor for questions. I'll take 5 sets of questions first, and apologies. I'll ask the media now to ask questions. I'll take.
And they must introduce themselves.
Yeah, they must
You must introduce yourself, the institution that you are representing. I'll start from this side. I've got 1, 2, 3. Yeah, I'll take those 3 for now. You first, ma'am.
Hi, it's Phaahla from SABC Radio. I just want to find out, where is Dr. Siphiwe now? Is he still practicing? Surely that's a danger to the patients if he is still practicing. Good day, I'm Suzanne Venter from Rapport. I'm the one who wrote the story. Yeah, so what I want to know, Prof. Makgoba, is when did you go to the hospital unannounced to visit the hospital and to see for yourself what is going on there? And the reason why I'm asking this is because I went to the Eastern Cape and I spent a lot of time there. I spoke to various psychiatrists, and Dr. Siphiwe was not going to speak on the record. So to verify the information that we wrote, I spoke to 2 former psychiatrists, a former occupational therapist, a former nurse, who were all intimidated at the hospital and due to that left. I also spoke to a doctor who was forced to falsify information in records. I'm a bit disappointed that the real issues, because yes, he did admit afterwards that he got confused with the death register numbers. But the real issues that he was concerned about and that we wrote about was that there's not enough medical doctors available on the premises for emergencies. There was recently a case of food poisoning I spoke to the family of that patient and they're still very upset. And there was 36 people who fell ill due to food poisoning. And the seclusion rooms, I'm delighted that they are now no longer in use. And then what was quite shocking to me is just after the report, I spoke to 2 anonymous people who worked at the hospital, actually 3, who told me the Sunday when the paper came out, I got a call from the Department of Health to warn them that there will be an unannounced visit the next day. And then the Department of Health, including the MEC, jumped in and cleaned the hospital. They cleaned out the seclusion rooms. They took out clothes and dressed everyone. They prepared fabulous food. For the first time, the patients there got fruit for lunch, for instance. And then they put up the show, and on behalf of some of the workers at the hospital, I was then sent a falsified document by the Department of Health's spokesperson then to tell me that Mndawe confirmed that whatever their representatives have told me about this cover-up incident is not true. Then we investigated that and we got confirmation that this document that was sent was false. It was falsified by the Department of Health in the Eastern Cape, and no steps was taken against that, and Mndawe's spokesperson said they were very upset about that. So there was indeed a cover-up, and
Can you shorten your question? I mean,
okay, yeah.
you are giving a lecture.
Sorry.
So we'll take the last one then.
No, because she is the one who broke the story and she doesn't.
Sorry?
My third question is Professor Makgoba. It relates to the seclusion rooms. Is it not true that those seclusion rooms, which incidentally were not built in 1894, but in fact built in the 1980s, would still be standing today if it wasn't for the fact that Dr. Siphiwe came out and blew the whistle about what was happening in those seclusion rooms, which in the SASOC reports have been labeled as high risk. So I'd like to answer on that. Then the second question relates to the death registers. When you talk about the death registers and you challenge Dr. Siphiwe's science on those death registers, is it not true that it would be very difficult to establish scientifically whether those death registers were correct or not, given that they were handwritten, given that there were 2 separate death registers, and given that there were subsequent allegations of cover-ups relating to information pertinent to this investigation? And what did you do about that? Then the third thing is with relation to the MDT. Now you say that there were these 51 patients were discharged by Dr. Siphiwe. My understanding is that that was not done by Dr. Siphiwe alone, but that was done by a whole multidisciplinary team. And I think we might need to correct on that. And then the last question is for the Minister with relation to the Provincial Task Team report, which I believe has been, according to the provincial spokesperson, on the Minister's desk since April. What is happening with that? Will it be released? And
Just come again.
Apparently, your provincial spokesperson told me in April that the Provincial Task Team report is on your desk and is awaiting release. Will that be released, and how different is that to this report?
Okay, let me answer the question.
Okay, thank you very much for the questions. I would like to appeal to all the members here on the floor just to be concise when you ask your questions in order to allow other members a chance also to also have a bite on the questions. Thank you very much. I'll hand over to respond to.
Okay, I think to deal with the first question, Dr. Sukeri is still a practicing psychiatrist, although he's no longer in the hospital. He's in private practice. So the reason why I'm saying that he should be suspended is because even in private practice, he's not safe to anybody. That's why I'm making that recommendation. The second question, the second issue Suzanne. Suzanne, I think you have done a lot of work. I've tried to articulate all that you have done, and you have been sort of meticulous. What I'm saying is, you have had sources, some of them anonymous. We spent 2 weeks in that hospital talking to patients in the hospital about what they are eating. We didn't get any complaints from them. They complained about having small portions. Now, as I say, that's not a human rights abuse. Again, you gave Dr. Sukeri your figures, 90 were dead. He approved that. He didn't come back to you and say, let's discuss this. In fact, in his own response, he says, he gave you a figure of 86, and you made it 90. Now, when he wrote to your ombuds, all you did was to say, we accept the correction, but you didn't apologize that you made any mistake, implying that you stood by your story. I mean, that's what journalists do all the time. So you have had your sources. Now, the people from Nehau, we spoke to them. One of them is conflicted because he actually is guilty of something, actually the chairperson of Nehau. So he's undergoing discipline, and therefore his evidence has to be looked with circumspection. You can't simply just take it because he's facing a disciplinary action and he's the spokesperson of Nehau. The issues about people going there on Sunday, I think the investigators spent 2 weeks there. If there had been any, they would have heard that. They did not hear it. But I think this platform is not for us to be going to and fro about the report. I've done my investigations. I've considered most of the things. And the conclusion I've come to is this, that you reported a figure of 90. The investigators here went and found the 2 only available death registers, went through them carefully and manually to assess the number of deaths. Because the next level of defense by Sukeri, when we asked him, why did you have this exaggerated figure? He said, no, I was counting on the financial year instead of their normal regular year, the calendar year. And they took him through the calendar year and the financial year with the 2 registers that he has and that he has confirmed. Manually, they picked up errors there of his registration, and he counted that if he goes to the financial year, there are 73 deaths and not 90. If he then goes on to the calendar year, there are 68 deaths. So I think just to answer the other lady's question, there are only 2 death registers. They are handwritten, but that is how they are being done. So that is not something that you can go and challenge. This is how the death registers have been. I mean, with due respect, that is how they've been doing it, and we can ask them to improve, but that's the available document that we have in order to calculate the death. Now, let me come to an important point I want to make. If these investigators had just assumed that this was 90 deaths, you know what we would be living with today? We would be living in our mind with that 90 people had died at Tower Hospital and in 1 year or whatever it is, and we know now it's wrong. So I think we must be grateful to the fact that they actually picked up the death registers, went through them manually. They not only went to Dr. Sukeri. In fact, Dr. Sukeri, in his own writing, he said, absolutely, I accept that this is the tally. So he's not in dispute on that. That it is 68. He used the calendar year. They had also come to the 73 if they used the financial year. So there is no dispute about the death. The important thing is the death is exaggerated as it was initially reported to 90. And we cannot run away from that. And that is the foundation of the damage, the exaggeration, and the false. Because it started from a statistical error that any respectable scientist should have verified. You verify your information, you cross-check your information, because the journalists trust you as a scientist. The public trusts you that you are the guru. If you say it, they trust you. Now, if you make that mistake, you must be humble enough to say, people, I made a mistake, I'm sorry, I shouldn't have done it. What you don't do is to go and say, oh, the death register was written by hand. But that's the very same register you used to come to the figure of 90. So that nullifies itself. So the precision of science and the manual calculation is what broke the camel's back, to bring us to the accurate figure that everybody agrees upon. Now, the Eastern Cape Task Team did not interview Sukeri. They just looked at the data that was available to them, provided to them. What did they come to? They came to a figure of 68. So let's get that. The total death figure at Tower Hospital in 8 years, it's 68. Over 8 years. It translates to 8.5 deaths per year, 0.71 patients' death per month. Is that abnormal in a 400-bed hospital? Think about it and be honest. In any other hospital, it's a mental health hospital, 0.71 per death per month in that hospital. What was your other question? The multidisciplinary, yes. Remember that who did the buck stop with it stopped, the bucks in the multidisciplinary team stopped with Dr. Sukeri. Not with he has never denied that, and we listened to that. He told us that. But he was the most senior psychiatrist. He was the one who was doing the data. He is the head of psychiatry. That's why he was employed there. And that's why he had this big fight with the CEO that, who actually makes the decision. And in fact, I engaged this with Dr. Sukeri in our meeting. I said to him, fortunately, I worked in England. In the UK, when you were the head of any section, the buck stops with you. It didn't stop with the head. So the professor of medicine who was the head of medicine at the Hammersmith or at wherever I worked, if I was in charge of endocrinology, he took cues from me, not the other way around. But now in South Africa, remember, you're used to BASCAP. So the head of the department runs everything. So everybody runs to the head of the department, even when you know more than the head of the department about the discipline. But you still have to ask him and ask for his signature. So these are things that we were discussing with Dr. Sukeri in my interview, that, look, in another country, in another culture, things are done differently. But what did you sign for? You signed that you are going to be under the jurisdiction of the CEO. She has the ultimate and the final word. Of course, she has got to have reasons for that. And the reason why the CEO was worried was because there was no assessment of social support in the community. And the CEO actually even gave an example that there is a patient who left the hospital and went to kill somebody in a taxi rank, murder somebody. Now, we also now know that in one of Dr. Sukeri's patients that was discharged has murdered someone. Now, is that the sort of doctor you want to have around you? Now, the fact that, as I say, the fact that the seclusion room have been repaired, it's a good thing, and as I say, I've reported it. But remember that this complaint had been going on since 2007. It's all there in the report when you get the full report. So this complaint is not necessarily Sukeri's, but I think maybe it has been exaggerated by the attention that the noise created when the story was released. So I just again want to urge the media. They got it wrong on this matter. Wrong. And the signs of it are so clear and so precise that you are not going to get away. When your star witness tells you, I'm wrong, and you have based your information on that star witness, I think you must sit with the star witness and say, let's talk together. You don't come here and be defensive, because you are not always right, and I'm doing this in the interest of the nation that has been damaged. by peddling false and untruthful information.
Just for the record, we never ever stated enough
No, I'm talking about this figure of 90 that created. Who's that? Who are you? Okay, no, I'm just saying, remember that the initial sin, you know, like when Adam and Eve ate the apple, that was the initials. The initial sin of this, I did go to Sunday school, I reported. So the initial sin came when a figure of 90 was bandied. I'm not saying that you used it. Yeah.
The 36 people with food poisoning.
Okay, the 36 people with food poisoning. Yeah, let me, yeah. We have agreed that in the Eastern Cape, like in many other hospitals, there are not enough human resources. So this is not a train smash. I think everybody accept that. In fact, Dr. Sukere wrote about this almost like in 2014. He wrote up because he did a big study. The tech and Section 27, they did that. When we were doing the investigation, we found that there was a vacancy rate of about 57%, however you took it. So the issue of short of staff is, nobody is contesting that because it's a common issue that is a problem within the health system. So I don't think we should be spending enough energy on that. The issue of the 36 and the food poisoning, we went into that. There is one death. Now, I'm going to ask you, if you have a death and you have had a post-mortem report from a pathologist, and who should we trust? Should I trust the findings of a pathologist or should I trust a journalist about the outcome of a death? The post-mortem results showed that the one death that happened was natural death after post-mortem findings. And I think if we are a normal society, we should accept that pathologists, when they do their post-mortem, we trust them unless we have reasons not to believe them. So that death, I understand the family is upset, but that is the final cause of death. It's a natural cause of death because the pathologists have done a post-mortem. Of course, if they had not done it, the hospital and the health system would be blamed. You did not do a post-mortem. So they did it. Was there a food poisoning there? We looked for evidence of food poisoning. Cultures were sent. There was no identifiable microorganism. It doesn't mean that it's not food poisoning, but they were sent. They are also part of what you're going to get in the full report. So there has been a proper investigation about the so-called alleged food poisoning. No causative agent has been found, but the person who died from natural causes on the basis of post-mortem findings. As I say, I'm a doctor. I would believe a pathologist rather than a journalist about the cause of death.
Excuse me, man. Sorry. Let's allow other. We are avoiding a dialogue. Let's allow other members also to ask questions. We'll have, post interviews after this. Maybe you can ask those questions. Can we have another round, the final round?
No.
Questions?
I had a question.
Yeah, he needs to answer.
Yes. There's a question here about the report of the Provincial Task Team, which I set up, which has been lying on my desk since April. I want to remind you what I said at the Live is Demanding hearing to Judge Musenek, that immediately after I got reports which emerged from the Gauteng legislature about the death of people who were discharged at Life is Demanding, that very same weekend, after informing the health Ombud that something like this has happened, he might need to investigate and the letter is coming. That same weekend, I discharged a team headed by Professor Soldrat Ayman, who's here today, who's the head of the Ministerial Committee on Mental Health, knowing very well that the Ombud is still going to assess, because I wanted to know urgently if there is anything that is causing the death of people that might still go on before the Ombuds came in to investigate. I did the very same thing about Eastern Cape, I sent in a team, and maybe let me finish the life is the many thing. When the report came from Professor Radaiman, I did not release it publicly because all I wanted to see was, is there anything that can urgently be done? And urgent things were done, like the closure of, what was this NGO here in Atteridgeville? Yes, they closed it immediately because they realized that, yes, people are dying and they may still die before the Ombud came in. So something happened about that report. I was doing more or less the same thing with this team. But the second reason that I did not release it, and I'm never going to release it, because with that report, I gave it over to the Ombud, the report of Professor Radaiman. I did the same thing with this. I said, Ombud, you are the final arbiter of everything, and here is a report. Take it in your investigation, you will read and scrutinize it and see if there's anything in it. So I handed it over to the Ombud. It was never meant to be released for the public because then, yes, it will be confusing. If you want to know whether it is saying different things from what the Ombud is saying, then you can go and look in the Ombud report because it was incorporated. The third reason I did not release it, the team was headed by Professor Zuki Swazingela, who is here today. She is the head of the Department of Psychiatry at Walter Sisulu University. She was heading the team. And when I appointed him, I was not aware of something I came aware with when they gave me the preliminary report. She had once written to the Department of Health in Eastern Cape to warn them about the actions of Professor Zugere, this discharge of patients. She did warn and say they are picking up patients who are being discharged without due process, and she's scared about the welfare of those patients. Just for that, I thought releasing a report which was investigated with her heading, when she already knew that something is wrong by the person she's going to investigate, it won't be fair. It won't be fair. So I said, if I release this report to the public, it can be challenged. Me too, I'm challenging it. And not because I don't trust her, but because she has already picked something wrong with the person. She can't then go and investigate and find something not wrong when she already knew that there's something wrong. So it helped to form the basis of the health Ombud. And that's why I'm not going to release it, because I don't regard it as a final report in this matter. Thank you.
Can I just complete what the minister has just said? When I received the report, I locked it in my PA's office. I didn't read it because I wanted to do the investigations for myself. That's one of the bases of being a doctor. You don't trust another person, you trust yourself first before, rather than be biased. I didn't release the report, I locked it up. The investigators of OHSC, I said to them, you are not getting this report. Go and do your work and do your investigation, make your findings, write your report. When you have written a report, your report, and I have written mine, we will one day come and say, let's open the box to see whether what we have found has any coincidence with what they have found. But also to be able to stay away from being biased by other people. And in fact, it was a week after they had written their own report, and myself, I'd written my first draft of my report, that they came to my office and I asked my PA, Linda, bring that report that you had logged. We opened it and we made copies for them to go and read it and come back and tell us, where does it differ from what we have found? And what can we reference? Where does it strengthen what we have found? And there was hardly anything to write home about. That is the sort of process that we were trying to follow, to do exactly what the minister was saying. Try to avoid being polluted and being biased before you do your investigation. Otherwise, there's no point. I would go in there to look for what they've already done. And it would be unfair on Tsukeri, it would be unfair on all the other people. So I just wanted to go there, clean And I didn't want to tell the media. They tried to chase me and find me where I was in the hotel. They couldn't find me, but that's life. That's their job. Thank you.
Thank you very much, Prof. I'll take the last final round of questions. I've got 1, 2, 3. Yeah, that's 3.
Brian Sakutu from the Citizen newspaper. I just want to find out, do we have any indication as to how soon are we likely to see the appointment of the new mental health administrator at the CK?
Let's take another question.
Susan?
Yeah, I just wanted to say on behalf of Report, Dr. Security did contact us and said he made a mistake with the figures, and we did publish a correction regarding that. And regarding the post-mortem of the person that died with food poisoning, we also saw the post-mortem, and indeed it says natural causes, but the cause of death is an enlarged colon, which the family is unhappy about because the patient complained about severe abdominal pains and didn't get any doctor to assist.
Sorry, Susan, I'm sorry.
Yeah.
You are putting us in a very serious difficulty. When you mention the issue of enlarged colon, the family is unhappy, because then to prove, we have to mention the diagnosis of a patient. It's grossly unfair. And the professor has just said it shouldn't be done. I know that condition we are talking about,
Yes.
and I know what it is. And it's not called enlarged colon in medical terms. It's a very well-known medical condition,
Yes.
which is natural.
Yes.
It's got nothing to do with food poisoning. But I'm not about to mention it here because that's exactly what Dr. Zugeri is being found guilty of. Time and again, the media put us in a situation where we are forced to disclose diagnosis of patients. You must understand that there are certain things that are sacrosanct to us, as they are sacrosanct to the media. The media will never, ever release a source person. They will never. They will rather die. I, as a doctor, rather die than be put in a situation where I must go around talking about diagnosis of patients, which I found confidentially during that psychiatrist was having a body of a human being here who can't protect themselves, cutting it out and to find out what's wrong, and you could say anything he wants about that human being, but that's not for public consumption, unless a court of law.
Yeah.
Yes. If the matter goes to court that maybe the pathologist or the government is lying or the Ombud is lying, that matter must go to court. Then, under the instruction of a judge, will we release that post-mortem finding, what it is? But we know it. I just wanted to clarify that because I was getting very scared that we are calling a press conference here to where everybody is listening, coming to debate about the cause of death of a relative, of their relatives, because they are listening to us. Let's desist from that, please. Thank you.
Thank you very much, Minister. Let's take the last hand then.
Just in relation to the seclusion rooms, just to clarify, would those seclusion rooms still be in practice today? Would they still be in use today if it wasn't for Dr. Sekeri's complaint? And then second of all, Prof, you talk about doing the interviews at a hotel room. Did you actually go to Tower Hospital? Did you actually go and stand in those seclusion rooms? And what were your feelings when you stood inside them?
Can I just answer you? I sent investigators from the health compliance to spend 2 weeks there. They came up with a detailed report to me, and I was satisfied with what they gave me. So I did not have to go and sit in the seclusion rooms, because I think as a medical practitioner, I know what are seclusion rooms. What I needed was to have a confirmation what they were. That's the first. The second point is that, as I say, it's not because of Sukeri that those seclusion rooms are being attended to. It's because of the drama and the noise that has happened. We traversed this argument with actually the finance manager in the Eastern Cape as to why, despite all these complaints that have been happening over years, it hasn't happened. Just like, for example, there are these human resource deficiencies that may now be given attention because of what is happening, not necessarily because of a single individual. I think let's just desist from that and say that they were built when the hospital was built. They should have changed when the Act came in 2002. They didn't change. So that's basically what has happened. That they are changing now, it's an accident of time, it's an accident of the attention, not because of Dr. Sukeri, but everybody accepted, every witness said, these were archaic, they shouldn't be used, and they need to be fixed. And Mr. Wilson, who represents the PSA, remembers complaining about those rooms in 2007. Now, if you go back, 2007, it's about, what, 11 years ago? Dr. Sukeri says he has been fighting for human rights of mental 12 years. So there's a difference of 1 year. So both of them, one was concerned about the seclusion room. Dr. Sukeri was just concerned about the general state of mental health in the Eastern Cape. And again, I want to emphasize, I have said that that complaint, it's an important complaint. That's why I've made recommendation around the Eastern Cape Department of Health as far as mental health is concerned. I have given the minister 90 days to find the administrator. Whether he does that quicker, I don't know. But it is specific about mental health. It's an important issue because it has come from many angles about mental health. I wasn't asked to examine all the other issues of the Department of Health in the Eastern Cape. It was about mental health, and that's what I have done. I hope I've answered you. Thank you.
Yeah, the issue of how soon will the administrator be, I'm hearing about it for the first time today. That the Branch Sokuta I was not privy to this report before because it was given only to those who were appointed. Now I'm hearing about it and I hear it's 90 days, but I can confirm that the Eastern Cape Department of Health has already been at work. And I was phoning the head of the department almost twice a week to understand that certain things are done. For instance, I phoned him twice a week because these 141 patients who were discharged had to be found. And so I was trying to follow up whether they are finding them. They had to put teams of psychologists and social workers to get the addresses, run around the Eastern Cape, finding them, readmitting those who are relapsing, those who have got accommodation. Remember, Dr. Sukeri discharged people, some of whom went to stay under bridges because they have nowhere to go. And that's not a way a patient is discharged from a psychiatric hospital. It was, yes, it's one of the things that must never happen because social workers need to go and see when you discharge a patient, where are they going to, whether they'll get support there, whether there will be psychosocial support. Otherwise, you don't discharge such people. So that work was already being done, and we'll go and focus on it. But thirdly, as Professor Makgoba said, something which I think people are not picking up. After life is demanding, we did put up a team here, nationally, to go and assess all the provinces about mental health to find out if a disaster like what happened in Gauteng may not happen. And we did write recommendations to provinces on what to do. The fact that some of them might not have carried the recommendation because they are crying poverty does not mean that no work was done. We did do it and say, here is the weakness, here is the problem. Like this weakness of a shortage of psychiatrists, as he's saying. Professor Ratayaman has already given you the figures. After all, they're out of the 700 psychiatrists in the whole of South Africa, which is still a small number, by the way, for a population. But the country has got 700 psychiatrists only. And he told you 75% of them are in the private sector, taking care of only 16% of the population, and the remaining 25% have to settle with taking care of 84% of the population. I'm repeating it because it's the central issue which we want to do away with in NHI. You can't have so many people taking care of only 16% of the population, and so few people having to take care of the rest of the population and believe there will be normality, and believe that when investigations are done, things must be normal. The public hospitals must be able to perform in the same way as the private sector with so many people. So it can't be so. The issue of shortage of doctors is something that we've been knowing, and we are making proposals in the NHI document, how we are going to resolve that. Thank you.
Thank you very much, Minister. And I would like to thank, our panel here, honorable panel, and also the media for coming. The copy of the report and the media statement, you'll find it on our way out on the tables outside. And also the report is available on the website, both OHSC website and also the Health Ombud website. Thank you very much for coming.